So let's talk about how not to push in labor and stay till the end. We'll talk about the best way to push in labor. So, closed glottis pushing, that is like the traditional OB way of pushing in the hospital that they've done for years. And the way it works is that the nurse or someone coaches the mom to take a big breath and then hold her breath and count to 10. So that's for 10 seconds, and to do that 3 times every single contraction. Well, the problem is in the research, we're finding more and more complications with that. So there's a risk that as mom pushes that way over time, that can decrease oxygen to the baby, which can lead to changes with the fetal heart rate, where we start seeing fetal heart rate decelerations. Also, if you think about it, pushing that way for 10 seconds 3 times in a row for a long time period, moms can get exhausted. And so that makes her more at risk, that the provider may need to do the delivery with vacuum or forceps, and that's where they help to pull the baby out. So let's look at some other ways of pushing. Now, exhale pushing is where the mom pushes while she's blowing out, or kind of a grunting sound as she's pushing. So we know that in the research, when moms push that way, we actually get more oxygenation to the baby. So the fetal heart rate has less risk of having those decelerations. And then also, a lot of moms prefer pushing that way because when they do, their patient satisfaction scores go a lot higher. So it's a little bit safer way to push as far as the fetal heart rate, and then moms like pushing that way better. So this is so cool. They actually did a research study where they did not coach mom about how to push, did not tell her how to push at all, and they let the moms push however they wanted. And guess what? They had their babies just fine. And that's called spontaneous pushing, when mom decides how to push. So some of those moms actually did hold their breath, but it was like 5, 6, 7 seconds and not 10. And you're like, well, there's not much difference there. But over time, that can really build up as a stressor for the fetus when you push longer than that. And then some of the women chose to do what we just talked about with the exhale pushing, where they're grunting or blowing out. So they tuned into their bodies and then they just pushed in the way that seemed to be more effective for them at that time. So, what if you're choosing to have an epidural for pain relief in labor? How do you push in that situation? Well, there's actually some different mixed results in the literature, in the research about doing what we call laboring down. And that just means a mom has an epidural, but even though she's fully dilated, we don't have her start pushing right away. We wait till the baby's head is lower or till she gets a really strong urge. So, there's some really great advantages with doing the laboring down. Those moms actually do their active pushing in a shorter time period. And so there's less risk of lacerations. There's less risk of moms getting so exhausted. And then babies do better. They have better what's called APGAR scores, which is just how they're adjusting to life outside the uterus. Okay. But there are some risk in some recent research that if we do the laboring down, the whole second stage, the pushing time of labor, can last longer. And there is a slightly higher chance of infection as well. So you really want to talk to your provider about those advantages and risks if you're going to choose to get an epidural, but a lot of facilities are still doing the laboring down because of those advantages. And so there again, that's a discussion between you and your provider. So where does that leave us? What is the best way to push? Well, it's really up for you to decide. So there again, talk to your provider about it ahead of time. And then in labor, when you get to the pushing stage, try to tune into your body. You can either do the exhale pushing where you're grunting or blowing out when you're pushing, or you can hold your breath. But remember, if you hold your breath, don't hold your breath for the full 10 seconds 3 times in a row. And the most important thing also to remember is that your labor support persons and if you have a doula, your provider, your nurses, they all need to be encouraging when you're pushing. They don't need to be coaching and counting to 10, but just giving you encouragement.